What's up, y'all? It's Celeste. It's been 6 months since I had my frenectomy, which makes this video about 6 months later than I intended for it to be. I've been very busy with other things. I've had a lot of other stuff going on, and I also just got super overwhelmed with the idea of making this video because I just had so much stuff that I wanted to cover, and I took about 1 million pictures and videos and things like that I was trying to make comparisons and stuff like that, and it just was a little bit overwhelming. I just didn't even know what to do with all of the content that I had, how to organize it or anything. But hopefully I have finally figured it out. I think I have. So we'll see. This video is probably going to be pretty long because I do have a lot to cover, and I originally intended for there to be multiple videos on this and to kind of separate this out, but as I've been working on editing it and putting it together and organizing everything, I don't know, I just decided that at this point, with it being 6 months past when I was originally going to be making all these videos, it just makes more sense to just kind of put it all together. I originally was going to be making the videos as I went along, and obviously that didn't happen. So this video will cover my actual frenectomy procedure, which I had in December, and the healing process, and changes that I've noticed over the last few months, and then kind of just an update of where I am right now. And just as a warning, this video is about me having a procedure done on my tongue, so there are going to be some close-up videos and pictures of the inside of my mouth and, talking about and showing the healing process, so just keep that in mind. So I'll start with the frenectomy procedure itself, which I had done December 2nd, 2020, by Dr. Elizabeth D. at Sweet Tooth Dentistry in Tampa, Florida, which is about an hour and a half from where I live. And Dr. D was trained by Dr. Serrapeptase I, who I talked about in a previous video. You can check up there if you want to watch my previous videos on tongue tie and kind of the general, just a general summary of the tongue tie treatments that I had and am having and maybe will have. And so he's trained a lot of other doctors and dentists to do this procedure the way he does it, and my dentist who I went to, Dr. Elizabeth D, is one of those dentists. So that's the reason that I chose her, because I felt like that would be the best type of procedure for me. I actually filmed the whole frenectomy, but because I was by myself, I just had to have it on a little tripod, and so it's not the greatest view. It shows what's going on, but it's not up close and personal. And also the audio is terrible on it because of COVID, they had these air purifier machines running. So it's not really something that I'm just gonna post, but I'll have some clips from it and kind of narrate what's going on so you'll understand what's happening. Before we get to the actual procedure, I did film a little bit in the car on my way there, just talking about kind of a baseline of how I was feeling at the time and what symptoms I was having the most strongly at the time. I did talk in a previous video about kind of the overall symptoms that I've had chronically that led me to realize that I had a tongue tie, but this is more specific to the actual point in time when I had the frenectomy done. So there'll be a little bit of that, and then the actual procedure, and then I'll come back. So I'm on my way to Tampa now to go to Dr. D's office and have my frenectomy done, and pretty excited about it. And I just wanted to give a little update on kind of how I'm doing right now. So I've had a lot of neck tension and jaw tension the last week or week and a half or so, more than usual. I kind of always have those a little bit, but it's been especially tense, kind of persistently, and I've had a lot of headaches, I think partly because of that, and then partly because of weather changes, pressure changes and stuff. I've kind of felt like it's been hard to take a deep breath. Also, again, also something I always kind of struggle with a little bit, but I just especially feel like I just can't get enough expansion when I try to take a deep breath. It just all feels kind of tight, and so definitely hoping that that will be better after the frenectomy, but of course we'll have to see. It might not be. Just wanted to give kind of a baseline for what I'm going into this frenectomy feeling like, and where I have especially a lot of tension right now. The first thing Dr. D did was kind of a final assessment of my mouth, looking and feeling around and making sure that she knew exactly where she needed to release, and confirming that with me and explaining what she was going to be doing. And then she took a bunch of before pictures for my records of my mouth from various angles. And then finally she had me hold a mirror to show me exactly what she was going to be doing, and demonstrating to me specifically about my buccal ties and why she needed to release the top ones and not the bottom ones. And then I got all numbed up and Dr. D started the procedure with the laser, and she did my buccal ties first, and then after that did my frenulum, which was what she released on me was the mucosal frenulum as well as the median lingual septum. And there's not a lot to show here, so I'll kind of skip ahead to when she was stitching me up with sutures, and then taking some final after pictures of my mouth from different angles and showing me how it looked now. So I just had it done. I'm actually still at the office in the parking lot, but I wanted to give a quick update, and here's what it looks like. Editor Celeste just jumping in here to say that I did not notice this until much later, but yeah, my middle stitch was gone. When I left my actual appointment, I had 3 stitches along my tongue, and I went into the bathroom to take a couple of like kind of immediate after pictures, and I still had 3 stitches. Here you can see them in that picture that I took. But somehow in between there and my car, I lost my middle stitch, which is definitely not supposed to happen. I don't know how it happened, but it did. And I didn't realize that when I was taking this video, so that's why I didn't mention it then. And then when I got home, I can't even actually remember exactly when I noticed it, but somehow I noticed it. And then somehow, like, shortly after I got home, I was down to 1 stitch. So I actually lost my top stitch as well. I have no idea how this happened. This is not what's supposed to happen. That's not what happens to Dr. D's other patients. I actually know at least one other person who's gone to her, and that did not happen to them. And yeah, I don't know what happened, but that was my situation. So I'm sorry, that does make it look a little scarier looking, and that's not how it's supposed to look. But that's what happened to me. So what you gonna do? And I actually also got my top 2 buccal ties released because they were creating a lot of tension that was pulling on the gums. So I actually was having gum recession from that. Anyway, the procedure went pretty well. I didn't really have any pain during it. I was pretty well numbed. I can tell that it's a little bit sore right now, so I'm going to be probably pretty sore later. But during the procedure, there wasn't any pain. My jaw got a little bit sore, but not as much as I expected. I was able to keep it fairly relaxed most of the time, and just had to keep my tongue up, which was a little hard since it was numb, but I apparently did a good job. And yeah, it all went pretty smoothly. I didn't have a big moment of release or anything, unfortunately, but I did have a point when I started feeling like I was trembling a little bit. Not like I was shaking a lot. I don't think they even noticed, but I just could feel that I was like trembling a little bit. And I don't know if that was from like this specifically from like the fascia being released, or if it was just the fact that I was having a medical procedure, and I don't usually get like really nervous for medical procedures or anything, but just having any kind of trauma to the body, and also like having to hold my tongue and having to try to stay still and breathe and stuff, I think could have made me a little bit anxious and stuff, so that could have been a factor. But anyway, that was the only thing I really noticed during it. Trying to think if there's anything else. Dr. D is going to be calling me this evening to check on me, which is really cool of her. And day after tomorrow, I'm going to be meeting with my myofunctional therapist, Deb. And she's going to be giving me some exercises to work on and everything, and get me on the road to recovery and full mobility with my tongue, which I'm already able to stretch my tongue way more than I ever have in my life. Like, it's never been that like elongated before. So it's pretty crazy. And then next week I have to come back here for a follow-up where they're going to check on my stitches if they're still there, and basically just like check me out, make sure I'm doing well. So I think that's pretty much it. And I'll have more later. Even though I didn't have like a big moment of release during the procedure itself, on the drive home, I definitely noticed a lessening of tension that actually came on a little bit gradually, because I didn't really notice it until I suddenly noticed that I didn't have the tension that I normally do. So I had, on the way there, I think I talked about that I had had a lot of neck tension, and I don't remember how specific I was, but it was like, oh, like the back of my neck and like upper traps and like this whole area was kind of always tight. And then also the front of my neck, especially my sternocleidomastoid, which are these big things here, were always really tight, and they suddenly weren't, which was cool. And I also felt like my jaw was a little less tight, I think. And then the other thing I noticed was that I could breathe more deeply, and I didn't feel like I was hitting this wall that I previously felt like I was hitting, where I would try to breathe and it was like I just couldn't quite get there. I suddenly felt like I could breathe more easily. I don't remember if it was that day or possibly the next day, when I actually touched in, like, around my diaphragm, like the top of my abs, like right under my sternum. That area actually felt springier to me, like to the touch. It previously was very tight and just felt like there was some give to it, but not a lot. It kind of felt like, it just felt really tight and kind of stretched, and it's not like, you know, super squishy now, but there's definitely more give to it, and that was like pretty immediate. The next morning, I also noticed that I had less tension kind of down my whole body. And this part is a little bit harder to kind of describe, because it wasn't like I felt necessarily tension in specific areas that I could point to. I mean, I did, but like what I'm talking about, the lack of that is, it's not like I could say specifically like this muscle or that muscle or whatever. It's just that I always felt like I had this line of tension throughout my body, kind of like top to bottom, that it just felt like something was being pulled, and it just didn't feel like that anymore. It's not like I don't have any tension or anything. Obviously you want to have some tension, but like I don't even necessarily mean that I don't ever have like excessive tension or like, you know, uncomfortable tension, because I still do. But like pretty immediately after the procedure, I just had a lessening of it. Like the way that I kind of always describe it is like there was this like guitar string that was pulled throughout my body, and, you know, it's like on the little pegs on either end, and somebody loosened it a little bit. So it's still there, like there's still some tension, but it's not as tense. Whereas before, I always felt like I was being kind of like pulled some way. It's very hard to describe if you've never felt this, and maybe even if you have, it's hard for me to express exactly how it felt for me. But I noticed that change the next day. I also felt like I was a little bit more flexible the next day. Like I did a deep squat and felt like it was much easier to get down all the way and keep my heels on the floor. And I just felt like it was easier because there wasn't this like constant tension. Again, like this level of tension that was always there. There was still some tension, but it just wasn't like to that level. So it made it easier to do everything that I was trying to do. I also noticed some differences around my actual like mouth and face area in the first few days that I did film myself talking about. So I'm actually just going to stick that in here because it'll be probably more helpful than whatever I can sort of remember at this time 6 months later. I of course took a lot of before and after pictures and videos, and some of what I've noticed in my comparisons are that my jaw is able to open a little bit wider now and with less tension. So if you look at especially my lower lip here, in the after, it's kind of more curved, so kind of the opening of my mouth is a little bit more elongated than it was before, where before it was like kind of flattened out at the bottom. And so that's a lot less tense now when I open up, and I feel like I'm able to open it a little bit wider than previously. There's also kind of less tension around my mouth than there was before, like around up sort of at the top of my mouth and like around my cheeks, and then like also like around the corners of my mouth, and like just kind of this whole area seems like it had more tension before than it does now. One of the most striking comparisons to me is a video I took of me reaching my tongue up to the spot, and the amount of neck and jaw engagement that was happening before, where it was just like tensing and my whole jaw was moving a little bit every time I just moved my tongue up, before was way more than it is now. Now it's mostly just my tongue kind of moving in isolation. There's still a little bit of movement down here because this is actually the base of your tongue here. The root of your tongue is like right under here. So there's a little bit of movement here, but not nearly as much. And along here was a lot more tense in the before than it is now. So it's no wonder that I had so much jaw and neck tension before, when literally every time I moved my tongue, I was creating tension in those areas. It's also not surprising that it impacted my singing, because having tension in your jaw and all of this when every time you move your tongue is not great for singing. I almost forgot about my buccal ties, which are up here. I'm not really having to do a whole lot for them. I'm just kind of letting them heal because they don't need to stretch that much, and there's not like much else to do with the wounds. They're just kind of like these little holes that need to heal up, basically. There weren't any stitches there or anything. Eating has been a little bit difficult. I have been able to do it, but I'm having to kind of go a little bit slowly with it, and I'm kind of avoiding some foods. I'm trying to avoid things that are like really sharp or like really chewy or anything like that, but I have had like normal food. I haven't had to be on a totally like soft food diet or anything, but I've kind of skewed towards soft foods, which isn't difficult for me because a lot of my favorite foods are kind of soft anyway. But yeah, it's been okay. It's been something I'm just trying to be a little bit careful of, but hasn't been a big problem for me. I think I'm also able to bend my head back more. It's a little hard to tell because, you know, this is the kind of thing that probably fluctuates a little bit anyway, but I feel like there's a little bit more flexibility in the front of my neck than there was before. So to me, it doesn't look like there's that much more flexibility per se, but I feel like the muscles on the front of my neck are a lot more engaged in the left-hand side, the before, than the after. I feel like there's just less kind of tension there when I bend back. Like, I don't feel like there's as much pulling me back down. Last night during dinner, we were sitting on the couch watching something, and I started to feel like I was kind of trembling. And I've had that happen a little bit before, just from various things, like just from either like muscle fatigue or anxiety or whatever, and I've learned to kind of just like allow it to happen and like let the release happen. And so I did that, and I was also kind of like rocking a little bit like this, and like just kind of like trying to release whatever tension was there that was trying to get out. So it wasn't anything like, I wasn't like totally convulsing or anything. It wasn't like anything too wild, but I did want to mention that because I had heard that after the procedure that it's not uncommon for something like that to happen, where kind of the unwinding of the tension throughout the body is happening and things are kind of like, you know, working themselves out. So what I had heard was actually more kind of like convulsions, but or at least I'd seen like one person mention that, but what I experienced was not exactly like that, but I think it did fall into that category, so I thought that was interesting and just wanted to mention it. So as I mentioned, I lost my stitches way faster than I was supposed to. And so basically what I was left with that first evening was a gaping hole in my tongue, which was a little scary looking, I have to say. But when Dr. D called me that evening to check on me, I emailed her a picture of it, and she wasn't too worried about it. She said that it should still heal fine and just, you know, to be careful with it. But that I probably was going to have to do more stretching during the first week because I wouldn't have the stitches. So basically, I can't remember if I've mentioned this before, so I'm sorry if I'm repeating myself, but basically with the way that the tongue heals after the frenectomy, you want it to heal quickly, obviously, because you want to get it over with, but you don't want it to heal too quickly. Mouths tend to heal very quickly, so just the amount of healing that can happen overnight is pretty significant. So if you just kind of leave the tongue and don't really do anything with it, it's going to spend a lot of time in a contracted position and it's going to heal that way. So you have to do a lot of stretching with it, and you have to keep it moving, and in order to do that, you kind of have to stretch out the healing process a little bit. Having the stitches there kind of keeps the wound, like the seam of the wound, kind of in a like more elongated position. If the stitches aren't there, that kind of pulls everything a little bit wider, which makes the tongue kind of contract more and kind of like widen instead of being tall and long. So that's the benefit of the stitches, and since I didn't have that, except for one little stitch at the bottom, I had to be a little bit more vigilant about keeping everything stretched and actually manually stretching my tongue. So by manually stretching my tongue, I mean like literally like taking a piece of gauze and like wrapping it around my tongue and like yanking my tongue around, trying to kind of like stretch it in all these different positions so that it would kind of elongate and keep the wound from healing contracted. That was the worst part of the entire healing process. That whole manual stretching, like it was very painful. My eyes would water every time that I did it, and it was just very much not fun. Now, I want to be clear that while manually stretching is, probably helpful for a lot of people, if you have the sutures that you're supposed to have, if they don't come out like mine weirdly did, you shouldn't have to do as much manual stretching. I'm not sure if you even necessarily would have to do any. The amount of just moving your tongue around like you normally would, moving it around in your mouth, might be enough. I don't know, because that wasn't my experience. So I don't want to scare anybody off by hearing about that and being like, oh God, I don't want to have to yank my tongue around and be in a lot of pain, because you might not have to do that. My situation was a little different because I didn't have the stitches, and so I don't know what it would have been like if I hadn't had that situation. The other thing that I did was use some stuff called Serrapeptase, which is an enzyme that originally came from silkworms. It's now synthetically made, and you can just get it in capsule form. But what it originally was on silkworms is this enzyme that hopefully I'm being accurate about this is my understanding, they secrete this enzyme that breaks up their silk cocoon when they're ready to emerge from it, so it breaks it up and then they can come out of it. So it's used in humans for breaking up other kinds of protein in the body that are excess or unwanted, whether it's in the blood, or I think maybe it's used for something to do with fertility. I think there's something to do with fallopian tubes. I don't remember exactly what it is. But you can just take the capsules apart and sprinkle a little bit of the powder itself directly on the wound, and it actually will help slow down the healing process. It's not painful. It doesn't really have a taste. It's just this kind of powder that you put in your mouth, and you don't have to use very much. And so I did that for a few weeks, and I think that helped. It itself was not painful in any way, but I did take a Q-tip and kind of spread it around and kind of try to break stuff up myself, which was not particularly comfortable. But after doing that and after stretching my tongue around, it actually would help my tongue not hurt as much. It would feel very sore from the wound contracting and getting tight, but then once I would do that, it would feel better afterward. It hurt a lot during, but it felt better afterward. So that's what I did for my wound care. The first day after my frenectomy, I was a little too aggressive doing all of that in the morning, I think, and I ended up getting really kind of swollen around my throat. All these lymph nodes were really swollen, and the floor of my mouth was really swollen. Just everything was swollen, and it was pretty sore. But I just gargled with salt water a few times, and that really took it down. So that was really only for a day or so. So overall with the pain, I feel I had more pain than some people that I've heard about, who said that they basically had no pain. But it was mostly just because of the way that my tongue was healing so fast, and I had to keep stretching my tongue around and yanking it around, and that part was very uncomfortable. If it hadn't been for that, it would have been a lot easier, I think, but that was just how mine turned out. If I hadn't been trying to slow down the healing, I think my tongue would have healed very quickly, because the amount of healing that I would see first thing in the morning when I would wake up was pretty considerable. It was kind of gross looking, but it basically would the hole would start filling in with this kind of white stuff, tissue that just filled in really fast overnight. Almost the whole entire hole was filled with this tissue, and every day, every morning, I would kind of break it up and then be able to stretch my tongue more again. But if I hadn't done that, if I just left it, I wouldn't have been able to stretch my tongue very much, but it would have healed really fast. It's been a week now since my frenectomy, and so I'm on my way back to Tampa for my 1-week post-op follow-up appointment with Dr. D, and hopefully she will conclude that everything is great. I haven't really had a chance to film any more of my experience and recovery and stuff since a couple days. Actually, was it the day? I guess it was 1 or 2 days. 2 days after, I think. Yeah, it was 2 days after. I can't even remember now. But basically in that time, my swelling went back down. I still have a little bit. This lymph node right here is still a little bit lumpy. but not as much, and I don't have like all this swelling like I did. So that really only lasted like a day. I have basically been sore when I've been doing my stretches with my tongue. Other than that, I feel like I'm able to use my tongue pretty easily now. Like, talking doesn't seem as clumsy as it did. Maybe a tiny bit, like maybe I'm a little bit just kind of getting used to the tongue now that it moves a little bit differently, but it's not because it's swollen. And eating is pretty much normal now. The only thing with eating now is that after I finish eating, usually I like use my tongue to like kind of wipe around my teeth and everything, like get anything that's stuck there. And I can't really do that right now because when I try to do that, I keep catching the wound on my teeth or on my permanent retainer that's on the bottom front teeth. So that's not very fun. So it's a little hard. I can't get my tongue around as much in my mouth, and all the little corners and stuff. But I am able to move it around just within the cavern of my mouth without trying to like touch my teeth or anything. Like I'm able to move it, and that's part of what I'm doing for my stretches now and my exercises now. I still haven't really had any neck tension or jaw tension for the most part. I had a little bit of jaw tension when it was swollen, and then occasionally when I wake up it feels a little sore. My teeth kind of feel sore, but I don't think it's from like clenching them. I think it's actually not my teeth, I think it's my gums. I think my gums are a little sore from kind of just the general inflammation of the healing process. I'm pretty sure that's what's going on there. I've run a couple of times and I had better running times than I've ever had before. The feeling that I had running, it felt a lot easier through my body. Like, I know this is so weird that just doing this to my tongue would have this effect, but I just feel less tension in my torso. When I would run before, I would try to keep my torso like upright and try to kind of lift, like as if I have a string pulling me from the top or something, to kind of like keep myself light on my feet so that I'm not like slamming down. And I would do that, but it would kind of feel like I was having to do something to do that. And the last couple of times I've run since I had the frenectomy, it's been like I haven't had to really work to keep upright as much. Like, I have to be kind of conscious of it, like it's a conscious effort, like thinking about it, but it's not like I'm like muscling to do anything. It's not like before I felt like I had to like tense something in my abs or like something. I was like doing something to hold myself upright, and I don't feel like I'm having to do that as much now. So it's just like a lighter feeling when I'm running. There's a lot of construction here, so I'm sorry it's kind of bumpy. I definitely have just had less tension throughout my body. Like, I've just noticed a lot less tension just day to day and when I'm doing things. I don't know. I think my only concern now is just like how I'm healing and making sure that I heal in a way where I'm going to retain the mobility I have gained since I had the procedure, because I happen to heal very well and the mouth in everybody heals pretty quickly. So it's just been kind of like fighting against my own healing properties to get it to not heal too fast but still heal well. So that's my only concern now. So hopefully Dr. D will say that I'm doing okay, but we'll see. So the whole appointment took about 5 minutes. I'm driving like an hour and a half each way for a 5-minute appointment, but there's not really a way to do that virtually, so you gotta do what you gotta do. And it went well. She seemed to think that my healing looked really good. I have granulation tissue that looks really great apparently, and all the colors and textures of everything look like they're supposed to when they're healing. And I asked her if she thought I was stretching enough, and she said it looked like it, but that right now is the most important time for that, because the wound is starting to contract now, and that a lot of times people who have this done kind of at this point start getting a little lazy about it because you get kind of tired of doing this over and over again. And she said to make sure I don't do that it's really important to keep it stretching and keep it moving, and just making sure that as it heals and sort of remodels the the tissue, that it does it in the new way that I want, not the old way. So hopefully, as long as I keep doing that and keep up what I've been doing, that my healing will continue to go well, and I'll be all done with not having to go back there anyway. Now I'm just going to show a little montage of the healing process. And again, some of these are kind of gross or scary looking, so sorry about that. But this is just kind of what it looked like for the first few days, and then weeks, and then months. The main thing to notice here is the blanching on my gums in the before that indicates the tension that was causing the gum recession there. It was just after 2 months post-op that I finally was no longer able to see any kind of visible wound on my tongue. So it did take a pretty long time, but most of that time it was not anything I really had to do anything with. It just was like still kind of visible from the outside, but it was completely closed up really. It just took a while. The way that it healed was actually kind of interesting. Like the hole filled in, but then it kind of like was like almost like inverted, where it was like turned outward, and then it had to like heal like this. So it was really strange, but yeah, it was a weird process that took a while, but most of it was very easy. It just looked a little weird if you looked under my tongue, which most people wouldn't do. Now, as far as the mobility of my tongue and the function of my tongue, which is, you know, the whole reason that I had this done, immediately after I had the frenectomy, I was able to elongate my tongue like way more than I ever had. It was great. Pretty much like starting the next day, it started to be a little bit harder to do that just because of the actual healing process kicking in and that contracting everything. And just over the healing process, because I wasn't able to move my tongue around as much as I would have liked because it was painful to do that, I just wasn't able to keep that same mobility that I had had. I still had a lot more than I had had previously, so it wasn't like it reset or anything like that at all. It just wasn't as much as it was like right after the frenectomy. At this point, after it's been 6 months, I definitely feel like it looks a lot closer to how it did before I had the frenectomy, which is kind of interesting. But if you look more closely, you can see, first of all, the frenulum is a little deeper on the left, and it also is no longer yanking up my salivary glands like it used to be. And then I also still have this lessened tension around my mouth. The shape of my mouth is more rounded now, and I don't have so much tension around my jaw. I still have a lot of the mobility. I maybe don't have quite as much as I would like. I do feel like it has regressed a little bit more than I wanted it to, and part of that is my fault because I haven't kept up with my myofunctional therapy exercises the way that I am supposed to. Partly because I just got like way overwhelmed with life. I've had a lot of other health stuff going on, and I've just had a lot of stuff I've been having to keep on top of, and having to do exercises several times a day, every single day, is just a lot to try to fit into a routine, and I just have been kind of a mess the last few months. So it's just been very difficult. The other part is that I still have a lot of jaw pain when I open my jaw all the way, and so the exercises are still really difficult for me to do because almost all of them you have to have your mouth open really wide, and that's just painful for me. So unfortunately, I just haven't been able to keep up with them the way that I should be and the way that I would have liked to have done. It's been a lot harder than I expected to do those. I didn't think that was going to be that hard, but it has been for me. But I definitely know that it's not back to where it was before the frenectomy by any means, because for one thing, I am still able to put my tongue up to the spot, and all of this neck stuff, jaw stuff, doesn't kick in and engage and try to get involved. I also, throughout my entire body, still feel that lessened tension, where, you know, of course, depending on what I'm doing, depending on, you know, what workouts I've done, the amount of stress in my life, whatever's happening around me, like the amount of tension that I feel in my body fluctuates pretty significantly. But I used to just have this constant feeling of tension, like this line of tension, that guitar string, that's just not there anymore. Like, no matter how much tension I'm feeling, like that in particular is not there anymore. So, you know, of course, my amount of tension also fluctuated before the frenectomy. So, you know, that was happening and this is happening, but that just one, like, that line of tension is just gone. So that's fantastic. I've definitely noticed a difference in my singing voice as well. It's not something I've really been able to test out as much as I would like, partly because I have been out of singing lessons for over a year now, and my voice has continued to kind of shift around during that time, and I just haven't really gotten a handle on it. And I just don't really feel comfortable enough in my voice, or like confident enough in my voice to, like, there's just not stability with it to begin with, that I can't just be like, oh, this is what I sounded like before and this is what I sound like after, and there's like very obvious difference. It's just very difficult for me to do that. So I haven't been able to do that as much as I would like. But just singing to myself around the house, I have noticed a difference. I've noticed that it's easier to do certain things. I feel like it's easier for me to sing higher than it was before, which is still kind of difficult because that's just hard. But I feel like there's a little bit of ease there that wasn't there before. I feel like my vibrato is a little bit easier, and like it just comes more naturally. And I also had finally taught myself how to roll my R's before the frenectomy. It took me like a year and a half, but a couple years ago I finally was able to do it. And like where I was able to do it, like it still wasn't great. It still was kind of like sort of doing it. After the frenectomy, that R was just so much easier than it had been. But because I'm not really like practicing any of this stuff right now, even that, it like fluctuates a little bit. Like right now it's actually not that great, so hopefully that sounded all right. Sometimes I do it and it's like super easy and super clear and I can just like keep it going forever, and then other times I try to do it and it like doesn't even happen. So I don't know, but it's definitely easier than it was before the frenectomy. So that really made me feel validated about how hard it was for me to learn how to do it at all, because I was so frustrated by that, and now I realize that that was because I had a physical restriction that like actually was making it difficult for me to do it. It wasn't just that I was, you know, not good enough. It was like literally physical restriction. So hopefully that'll be the same with some of my other singing things that I've struggled with. I'm really hoping so. As far as other like specific tension stuff, like I have definitely had some like neck tension and jaw tension kind of off and on. I don't feel like it's ever been as significant as it was before the frenectomy. I recently have had some neck tension, and even that, like, it hasn't really been painful. It's just been kind of annoying. Like, I just have kind of felt like I haven't been able to move, and you know, it's a little uncomfortable. It's like a little sore, but it's not really like a painful sore. Jaw tension has not been really great. It hasn't been really super painful, other than like any time I open my mouth for very long, it just gets sore and painful. Setting that aside, I'm talking about just like generally feeling pain and like waking up feeling like I've been grinding my teeth, or like I'm clenching my teeth. That's still happening a lot, and I don't know exactly why. There's still some reason why I tend to clench my teeth a lot, especially when I'm lying down for some reason. I've noticed it like the last couple of days. I've especially noticed like I try to relax my jaw and I'll be able to do it, but then it just like immediately goes back. I don't know why. I'm still working on that. But I still think it is better than it was before the frenectomy. I don't know. Unfortunately, the frenectomy did not get rid of my headaches. I still have had a lot of migraines, but I have realized that I had a lot of other factors going into that. Not to get on a whole other tangent, but I realized at the end of last year that I had an iron deficiency, and it actually got worse over the holidays and like into February. And so the last few months I've been fighting that and like trying to recover from that. I also had some other deficiencies and basically just like some other major health things that I've been trying to get figured out and get dealt with that have all been other like factors in a lot of stuff that kind of overlaps with the tongue tie stuff, like headaches and tension and muscle pain and joint pain and stuff. I also had COVID in March. So there have just been a lot of other things that have contributed to me having headaches, and I actually feel like my headaches have gotten better. I need to find some wood to knock on over the last like month or so, and I'm hoping that's because I've gotten my iron levels up finally and some other levels up and feel like I'm doing a little bit better health-wise. Hopefully that's why my headaches are a little bit fewer and more far between. But anyway, unfortunately the frenectomy itself didn't get rid of that, but I had all these other, factors that have been playing in, so take that as you will. I know that was a lot. I hope that it was helpful to anybody who has been thinking about getting a frenectomy or is just curious about it, or just, I don't know, just wanted to watch me talk for however long this video has been. If you have any questions, you can leave them in the comments below. If you like this video, give it a thumbs up and subscribe to see more of my future content, and hit the notification bell so you don't miss anything. Thank you so much for watching, and I'll see y'all next time.